The greatest compassion is fighting against the medical challenge with courage, alertness, kindness, and patience. You stay at home. But for us, medical profession is different. We stay at a hospital. And discovered glittering gold in healthcare system. Hi guys, let me start by thanking the organizers of our today program or presentation. I would like also to use this opportunity to thank you for being the good follower of our different programs. My name is Ruchius Philbert, and today I'm going to address to you one of the area titled as Undiscovered Glittering Gold in Healthcare System. The question is, what is that undiscovered glittering gold? A nurse. In what area? Wow, in medical research. Now, let's ask ourselves, why nurses are potential in initiating scientific research writings and producing evidences? That's a question to which we should ask ourselves. Why nurses or why nursing is a potential profession in initiating scientific research writings and producing evidences? Every nurse has a role to play in scientific research studies, whether it can be participation at the initial stages of research proposal development or participation at the level of research implementations. Now, a nurse also can play a role in research as the user of the products of research or of scientific research. And now, there is no any way a nurse can learn away from participating in scientific research or from playing a certain potential role in research studies. A nurse is a potential person in any of the multidisciplinary team, especially during the implementation of the medical research activities. Now, to start off, let's see the definition of the medical research. Now, speaking of the medical research, we mean the process of scientific investigation. The process of scientific investigation or inquiry in health or medical problem. So, it's a systematic investigation about a certain phenomena, aiming on finding the new evidences or aiming on finding the solution about a certain problem. And the main purpose of scientific research is to find the truth and to suggest a solution about a certain problem. So, there are reasons for doing research. Everyone should know, why do we do research? Wow! The main reasons for doing the medical researches are to solve existing problems in the delivery of health care. So, there must be some of the gaps in the process of care and the treatment maybe. So, in order to find the solutions of those existing gaps, in order to find the solutions of certain clinical problems, it means we need to employ the research. We need to conduct the medical research. We need to produce the evidences through conducting research. So one of the reasons of doing research is to solve the existing problems in delivery of health care. But the another reason is to find the answers about the certain program or about the policy questions or materials for publishing. That's also one of the reasons. So we always do research aiming on finding the answers about a certain program. Then what are the source of research problems? Remember, before conducting a research, you have to think of problem. The problem, I mean a certain gap to which you want to explore, to which you want to investigate. So before initiating the proposal, development, before thinking of developing a scientific evidence, you need to think of first of the problem. What are you trying to investigate? So there are things you have to consider about the problem you are expecting to explore. So the problem you want to investigate should have two qualities. There are two things you have to consider: the importance of that problem here, or the importance of that situation you want to investigate. So on that area, you need to explain why is that important to do investigation about that problem. You have to define your problem. Why do you think it is the right time to conduct investigation about a certain area? What are you trying to investigate? What are you trying to influence? So you need to define a problem before conducting a research. Then the second thing to consider about the problem itself is questions to be answered. You need to point out or to show what questions are you expecting to be answered by your research. Clear? So you have to think of that. Develop a research question and think of how are you going to explore in order to answer your research question. Wow, thank you. Now, after being aware about the problem as one of the starting points of conducting research, now you have also to understand what are the sources of the problem. Where can you find the problem in order to do the investigation or to do the research? From routine practice, yes, in healthcare system, during the process of care, during the process of treatment, we can also use that opportunity to identify gaps or to identify problems to which research is needed. But also from suggestions from the academic institutions, sometimes you can identify the problem basing on the suggestions which are given by the institutions, especially these academic institutions. But also you can look into the research priorities of the ministry. Ministry has got its priorities of research. So you can go into those priorities and select the problem to investigate and develop evidence. And another area you can use to find the problem for investigation is research priority list from funding agents. You know, every funding agents, either local funding agents or international funding agents, they have their priorities. So you can find the area to conduct research by going into the priorities of a particular funding agents, either local or international funding agents. And the other area you can use to find the problem for the investigation is the request from drug or device manufacturers, especially in those industries. So you can also find the problem to investigate through suggestions which are coming from the manufacturers or industry, through the special request from the manufacturers or especially drug or device manufacturers. And also requests from service provider. We nurses, we are in the position to initiate the research development process. We are the position to initiate scientific writings because we can be giving the request about the area which needs to be explored, which needs to be investigated for the further improvement of care and treatment. So another source of the problem are those suggestions or requests incoming from the healthcare providers, either nurses, doctors, pharmacists, laboratory technicians, dental surgeons, and other professionals. Wow. And also you can find the problem for investigation through going through the literature, different articles. You know, some of the articles which have been already developed about a certain area, you can find some of the gaps by doing the critical reading about those literatures. So you can also identify gaps through reading different articles, going into the literature, in summary, doing the literature review. Okay, now the important thing you have to be aware of, which is also the focus of what the program is about, the involvement of nurses in medical research, involvement of nurses in the development of scientific evidences in healthcare system. Every research nurse, and the practitioners have the common goal to achieve by providing the best nursing care possible, and nursing care based on up-to-date evidence. What I mean here, clinical practitioners and research nurses, they can work collaboratively to provide the best nursing care based on up-to-date evidences. So scientific research can help us to find the scientific answers about the problem itself, and also we as nurses. So it's through scientific research where we can find the problems in nursing as a profession, and also find the problem in nursing care practices. So which in turn can result in the achievement of goal, which is to provide the nursing care based on the evidences, based on up-to-date evidences. So provided that the researchers and the clinical practitioners work collaboratively. So I am submitting this to you. Research nurses and the clinical practitioners should join forces, should work collaboratively in order to achieve the common goal of developing scientific evidences in order to make sure that the nursing care practice are being into the place based on the up-to-date evidences for the benefit of the care and the treatment, and for the benefit also of the patient progress in terms of treatment and care. So clinical or medical studies are aimed at improving the clinical practice and the better patient care. So the aim of conducting the research is aimed at expanding the frontier of knowledge in order to meet the certain needs, or in order to meet the certain demands in healthcare industry. So research studies is a very smart and professional way we can use as nurses to identify gaps in area of the healthcare industry, and also to develop the environment-friendly ways in order to fill those gaps. So the very important things here we need to focus on is that research is a very smart and professional way to use to identify gaps, but also professionals feel confident and were convinced to accept the presence of a certain problem, provided that there are evidences or data developed about that problem based on the pilot study or sample surveys. Yes, now it's also through research which we can be at a very better position to test the feasibility of a certain nursing care practice. It can be also the very good way to assess the peak performance or to assess the standard of patient care or nursing theories. So the time is now for nurses to see ourselves as a potential goal in medical research, to see ourselves as the very potential and the needed people in area of medical researches, especially on development of scientific evidence, through showing the great participation in research at different stages, from the initial stage of research, scientific writings, up to the implementation. So, although there is increasing the number of qualified nurses who are investing much in research this time around. But engaging in a basic or clinical or medical or epidemiological research is very potential for all nurses everywhere in the world. So it's very important for nurses to be aware about the needs and to be aware about their importance in participation in area of medical research as much as they can, to the extent they can. We need more nurses in research. The question is, are you ready? I think you are ready. Now, nurses or practitioners can participate in scientific research in many ways. Are the ones who can keep abreast of the new knowledge or evidence coming from the research or coming out of medical studies. So the reason for doing research in area of our clinical settings is to solve an existing problems and to bring new inventions for healthcare provision and to get answers about certain problems. So there are different sorts of problems for research, as I already discussed about that some of the problems can be identified from routine services in our clinical areas, but also from requests from healthcare providers or nurses themselves. A nurse is a potential person during the process of identifying clinical problems. A nurse is a potential person during the process of identifying gaps in the process of care and treatment, and to find the clinical problems for which research is needed and communicate this need to researchers, or may play part also. A nurse may also play the potential part in identifying gaps in health care for the further improvement as they stay longer in clinical area with patients comparing with other professions. Cheers to all nurses. So that situation, that system of nurses to spend more time with the patients more than the other profession, this gives the opportunity for nurses to be at a better chance to identify gaps for the further improvements. So this is why I'm saying we nurses, we are potential, we are gods in the health system, we are gods in the medical research system, especially in initiating writings for research to develop scientific evidence. We can realize the truth about ourselves at the heart of the medical system. We can realize the truth about ourselves as the backbone of healthcare system in area of research through showing huge participation in medical studies. So, nurses have the big role to play on implementation of research activities, especially on data collection, on data analysis, and including also report writing. But also nurses can play a very crucial role on supporting, supervising, coordinating the implementation of the studies and initiating scientific writings. And also nurses can contribute to the papers for publications in reviewed journals. But also, we nurses, we can participate at the level of development and the submission of grant proposals, and also we can assist on the submissions of research study protocols for the institution or the national ethics approvals. So currently, many practitioners, both senior and younger practitioners, are beginning to be interested much in doing research themselves, and they are passionately seeking the help, especially on skills needed on area for proposal development. So they are showing the great interest in carrying out simple but carefully designed studies in clinical areas or settings. Cheers to all nurses out there. So no wonder that nowadays some hospital institutions employ research nurses or research consultants whose function is to stimulate and guide the nurses in conduct of such studies. So I'm submitting this to you that the different health institutions in the world should also find the way to recruit or to employ nurses who are specialized in area of research, special nurses in research, in order to assist in stimulating and guiding nurses in the conduct of such studies in clinical settings. So small and less sophisticated studies can be done by nurses even with a very basic or elementary skills in research. So balancing time for research activities and other commitments in the clinical area can be a bit challenging for nurses because nurses have a lot of stuff to do in the clinical area. So that creates the need of recruiting special research nurses, of recruiting research consultants to assist the nurses in stimulating and guiding the implementation or development of different studies in the clinical areas. So practitioners or clinicians or nurses with intellectual curiosity and the spirit of inquiry may read them to the problems at first hand and define them and begin to study them. So it's all about also the curiosity of nurses to look for the gaps, to define the gaps, and also to begin to study them. So the result of the efforts of investigating the gaps may inspire them and others to do more comprehensive, sophisticated studies of other additional problems or questions. So they can start developing a less sophisticated study, and the result of those small studies in clinical area may inspire them to do a more comprehensive and sophisticated studies in clinical settings for the further improvement of healthcare industry. So we sometimes encounter problems or different situations while we are fulfilling our commitment in areas. So those situations can be met while we are taking care of internal customers, patients, or while we are taking care of external customers. So the time is now for nurses to raise interest in research in order to be better at a better position to find the solutions, to find the scientific answers about those situations or about those problems for the further improvement of healthcare services. So the real science behind our practice depends on a constant investigation of unknown to find scientific answers. So now let's see, why do I say nurses are potential in developing or producing scientific evidence? First, they are trained in research. So research is one of the academic competence in colleges or university. So we are trained in research. So we are at a better position to conduct different studies. We are professional. We are at a better chance to develop evidence. We are at a better chance to develop different research proposals for implementations. And also, nursing is an independent professional. That's our law. A nurse also is a researcher. Me, I've been investing in research for more than 2 years. So, nurse is also a researcher. We are independent profession. We are independent profession, and research, it's our law. Now it is time for us to invest in research. But also, the another point, we are experts at our area. We have got skills, we have experience, we have knowledge. So let's show it. Let's show why we are goals. Let's show people why we are potential goals. Let's discover ourselves as goals in conducting research. Let's develop more evidences. Let's do more research studies. Let's show that we are the best at our area. We are experts at our area. Let's use our skills, experience, and knowledge effectively also in the area of medical research to develop more scientific evidence, to publish more and find more articles to share with the different people so that they can see our contribution in area of care and treatment, especially on that matter of developing scientific evidences. And also time spent in wards. I did one of the simple survey to different nurses. Most of the people say we are spending more time in the ward. So being so busy in the wards, we can't dedicate also our time in writing research. My friend, I'm submitting this to you that spending time in the ward more than the other profession, that's a great positive thing to think of. it means we are at a better position to develop evidence. We are at a better position to find more problems for investigation. We are at a better position to go into the deep of the healthcare system with the tears and find gaps for investigation in order to improve more our healthcare services. So spending more time in wards should be taken positively as a better chance for us to identify gaps in order to investigate through researches. Now, let's look on the challenges and the solutions on area of participation of nurses in medical researches. Nurses are going through some of the challenges, and one of the challenges, time, workload. You see, that's one of the challenges that we are going through the unfavorable situation in a way that the environment is not friendly for us nurses to conduct more researches because of the workload. But I want to take this positively that spending more time in wards is a chance for us to conduct more studies because we are at a better position than any other profession, especially in area of identifying gaps in the healthcare system. So spending more time in wards should be taken positively as a starting point for us to develop more proposal and to implement more studies. So nurses, we need to make the balances about our commitment, and also we have to dedicate sometimes also in developing proposals for implementations. Another challenge is motivation. So motivation also is one of the issues among nurses towards investing in research. So my thoughts is that institutions, different health institutions, should also include research as one of the promotion criteria, meaning that during the performance evaluation of the nurses, also research should be one of the area to use as a criteria, and also should be the promotion criteria at the workplace. So that can motivate more nurses to invest in research and to invest also in a very small studies in health care settings for the further improvements of our care. But also another challenge is attitudes. So attitude for some of the nurses, the challenge in one way or another, thinking that people, they do think they are not at a better position for themselves to participate in research. So we needed to develop the good attitude. We needed to develop a high favorable attitude on area of research by making sure that we also invest more time in area of research in order to show our potential, in order to show why we are gods in the area of medical research. So we need to develop a highly favorable attitude on area of research, we as nurses. But also the another challenge is funding opportunities. So how would you like to submit this to you that in the different health institutions there should be different funds or grants and competitions for those who are interested in research. So the presence of local funds in health institutions can motivate nurses also to be part of the competition processes. So we need more funding opportunities, local and international. And also I'm submitting this to nurses that they have to explore more grant opportunities. So the another challenge is the issue of research mentorship program on proposal development. We also need to see more mentorship programs on area of proposal development. So I'm submitting, this is my thoughts, I'm submitting to the different health institutions that they have to develop different research mentorship programs to help the health professionals, including nurses, on the area of proposal development, data analysis, report writing, research study implementation. This in one or another way can help to give basic skills for nurses to do more researches in clinical areas. So we need more research mentorship program on the area of proposal development. So to finalize, I also have some of my thoughts on the area of nurses and outbreaks or pandemics. So there are different incoming outbreaks, there are different incoming pandemics. So we also needed to see the contribution of nurses on those situations of outbreak or pandemics. By seeing the involvement of nurses in the development of simple surveys or studies like response to treatment about a certain outbreak, the care and the treatment about the certain outbreak, and the gaps in care and the treatment process concerning a certain medical challenge or the outbreak. So on the area of pandemic outbreaks, nurses should also participate fully in doing simple survey or studies, but also they should participate fully in the area of creating community awareness through giving health education in the community about the prevention or precautions about a certain outbreaks or pandemics. But also, nurses should participate fully in the area of care and the treatment guidelines development. So we need to see more nurses because they are the ones who are going to make the use of those guidelines. So we need to see more nurses involved. We need to see more nurses participating in the care and the treatment guidelines development. So by working on those areas, it's where we can prove ourselves as gods in research. It's where we can prove ourselves as gods in fighting against outbreaks or pandemics as well. So the time is now for us nurses to prove ourselves on why we are glittering gold on research. It's time for nurses to prove why we are glittering gold in community health. The time is now for nurses to prove on why we are glittering gold on the area of care and the treatments. We have to prove ourselves on why we are glittering gold on the area of fighting against outbreaks or pandemics. And my friend, it is possible until you try it. Every nurse has a big part to play in the area of medical, clinical, or epidemiological studies. Again, it is impossible until you try it. Every nurse has a big role or a big part to play in the area of medical or clinical or epidemiological medical studies. Thank you for following my presentation.